It is time for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave. Good morning, everybody out there.
We like to cover a lot of topics here on Wellness Wednesday. We talk about hyperbarics a lot, and we talk about ozone treatments and ozone therapy and all kinds of things. Today we're going to talk maybe something a little more traditional, and with the goal at Okoboji Wellness Clinic to thrive, not just survive. In time, maybe some of those Band-Aids that you have taken out in the name of pharmaceuticals to help you feel better, maybe you get to a point where you can think about coming off of some of those pharmaceuticals. But it's not quite so easy, Dr. Bradley Meyer, as just saying, hey, I'm done with this. Today's the done day.
Yeah, it's not quite so easy, and it could be dangerous if you just flat out stop them, the pharmaceutical, whether it's a blood pressure medicine, it's a thyroid medicine, whatever it may be. Your body over time has developed it's gotten used to that being there in your system. And so it'd be like the equivalent of pulling out the rug from underneath you, and the body all of a sudden shakes the system there a little bit. And so for some things, yeah, it absolutely can be something where the guest, the patient, feels that if they were to stop it suddenly. So that's always something that we want you to work on with a provider, a physician, or a nurse practitioner, and work in the process of responsibly coming off of those medications when indicated, when the timing might be right. Now, sometimes when a disease process is so far down the road, getting the body back into that balance state can be a little bit more difficult and challenging, and it can take us some more time to work towards getting to some of those goals of less medication. But it's one of the big things that it's called polypharmacy. I remember when I used to round in the nursing home, and I was always just struck by how many medications those poor folks were on, and sometimes we're talking 15, 20 plus prescriptions, and I don't know how anybody could be on so many medications and not have that affect them. And really, again, as we talk about the goal to optimize one's health in a positive way so that you are experiencing life in the day to the fullest, so you're able to have fun with your grandkids and your own kids and be active and not be thinking of what you can't do because of whatever that condition, disease, or physical state may be, but you're just flowing. And so the process when you come into the clinic here, it's a process where you again look at the whole body systems of almost like links in the chain and some detective work, and we find out through blood work, through conversation, where those weak spots, where those weak links are in the chain. And a lot of folks that are on a lot of medications have 4 or 5 links in that chain that are pretty weak. And a lot of the time the problem is that folks that are pretty sick don't seem to make any progress when they are looking for answers. It's because too often just one link in that chain is addressed. And so it might be the heart chain, or it might be looking at the detox centers through the liver and the kidney, but not addressing the thyroid or not addressing the heart. And all of these chains or links in the chain are interconnected. And so if multiple ones are out of place, if we're not addressing them pretty close to at the same time, it could be more difficult to make progress from getting the body back into a state where it's humming along, doing well. And for that matter, when it comes to being on multiple medications, what can we do to elevate the body's natural systems that help elevate wellness? And that's a big piece of where we go when folks come to the clinic, when I don't just rip the Band-Aid off and say, oh, we're going to stop that medication. And in fact, when Paisley was on last week talking about our wonderful friends from South Dakota, that she came in and her husband and horrible fatigue, brain fog, could barely get through a day due to the significant amount of pain, easily on 10 to 15 medications. And right now, she is still sitting at 10 to 15 medications, but she's 70% improved. And I will be, in the days and weeks going forward, start looking to say, okay, which one of these ones can we start to peel back? Now, how did we get that 70 to 75% improvement? This is where we started to work to say, okay, what were the weak chains in the chain link fence there? And then we started things like hyperbaric therapy for her. We adjusted her digestion, her diet, what could be inflaming her, doing some ozone therapy, IV vitamin C. And so her body is just handling even the pharmaceuticals better, because when you have that many pharmaceuticals in there and maybe your liver's not working quite as well, the liver and the kidneys are what we use to get rid of the pharmaceuticals after we've absorbed their contents. And if we are having difficulty with our liver, then the more pharmaceuticals that we're on, there's the potential that they could have more negative side effects because of that. So again, in her case, and in many cases when we work with folks, it's okay, let's amplify that mitochondrial health in a big way. Molly and I were just about ready to embark on a further journey into the gut and take a deeper dive into that together. And she is the guru genius when it comes to the microbiome and digestion in the gut. And that is another big piece that we work on here at the Okoboji Wellness Clinic, but it is going to be another big pillar for us, an even bigger pillar as we move forward on people's wellness journeys, to be able to get them off more and more medications. So again, and I was a victim, I won't say it. This was me as well. I think the most prescription medications I've been on was maybe 4 or 5 myself over the years when I was practicing traditional medicine alone instead of integrative medicine, both traditional and holistic. And it seemed like I went from heartburn, so I went on a heartburn medicine, to I need some energy medicine, and then I went to, I started to get some restless legs, and now I needed a restless legs medicine. And that's what can happen is the one side effect you can potentially have as a result of one medication can lead to adding of another one, and then it just gets away from us to the point where by the time you turn around, you've got 10 to 15 prescriptions. And in many cases, like this gal that came in, she was not thriving. She was pretty miserable, so she's on all these medications. And again, like I say, there's a time and a place, and sometimes situations call for these things. In her case, certainly not where she needed to be, and I know she's going to be looking forward to the peeling back of these medications and be on less and less.
Yeah. We wanted to talk to you about that. One of the topics I've seen, especially some of the doctors that I follow, talking about benzos and SSRIs. These are not drugs to come off of easily. Some of them take months, if not years, to come off of properly. And so people need to make sure they're getting the proper medical care to come off of some of these drugs.
Yeah, the thing is, too, and we've talked about microbiome, Dave, in the past. 75-80% of our immune system sits in our digestive tract. The more and more we learn about the organisms in the digestive tract, there's some that are harmful, and then we get an overgrowth of those. There's some that we don't have enough of that are helpful to our immune system and helpful to things like the heart, or to mood, neurotransmitter production, which is huge for mood. A large part of that takes place in the gut and is tied to this microbiome. So what we want to do is look at that digestive tract as well when folks are trying to get off of medications and say, what does that look like? Are we short on certain really essential bacteria in the gut that would support different things. So we found that there's bacteria that have a commensal relationship with the brain. There's bacteria that have commensal relationship with, or symbiotic relationship with, the heart. So let's say somebody is saying, I have a history of heart palpitations, for instance. When we do some digging and mapping of the gastrointestinal tract, we can start to identify also what organisms might be underwhelming or not enough of, that if we build them back up and support that gut in those particular organisms that are in this commensal symbiotic relationship with the heart, for example, that you may see things like, oh, okay, when I've got those there, my body's in balance more, and it might be that it's easier to come off of these medications, and I notice that the symptoms are going away, are not there, because I've really worked to support that digestive tract.
Yeah, this is a great topic. Like every Wednesday, it's all about thriving your day, not just surviving. This is another piece of peeling that layer back of the onion, whether it be talking about your medicines or hyperbaric therapy or red light therapy or ozone therapy, on and on. All kinds of things offered to make you thrive the day, not just survive, at Okoboji Wellness Clinic. And if people want to get started on that journey, Dr. Meyer, what is the best way to get a hold of you?
Give us a call. Yeah, give us a 712-339-6024. We do complimentary discovery calls. I do them myself, and some folks will want to take that journey with Molly, our functional specialist as well. She's phenomenal, and she can take you start to finish on the process as well. So she does a discovery call that's complimentary, 15 minutes, as do I. Mychal Sheridan does one as well to discuss reflexive brain work. And many times when folks come into the clinic and get started on the process, they may just be dipping their toe in the water and say, I'm on board, but I'm not ready to go all in, and that's okay. We're ready to meet you where you're at, but if you're ready to just expose yourself to something a little bit different, that's okay. Some folks then will come in and say, hey, I'm all in. I want to try everything and get going because I'm tired of feeling not good. And that's where our whole team a lot of times will collaborate, work together, and I'll have you meet with Molly. I'll have you meet with Mychal, and you'll see other members of our care team as you move along, because we're, over the course of a 2 to 3 month window there, we're moving pretty fast, really trying to cover a lot of territory as quickly as we can, as quick as your body will allow, versus, again, the folks that just want to say, I'm just curious. I just want to make that discovery call, learn a little bit more, and maybe I want to come in and see what it feels like to experience Okoboji Wellness Clinic, and then maybe just transfer care just for traditional care where those prescriptions are needing refilled. That's that direct primary care membership, and over time you might be curious about, oh, yeah, I think I want to start to get off some of these medications, and I want to start down this road, this holistic wellness road, and I'm ready to dive in faster. We're there for you as well. So we're there to meet you at the tempo where you're ready to go. Just know that I look at myself and we look at ourselves as a bridge, because there's still too many people out there, Dave, that aren't aware that you can feel better. It's never too late, in my opinion, and that it just saddens me to see some folks that have been in the spot for 10 to 15 years spinning their wheels and not feeling any better, that don't know there's another way. So sometimes just getting in the door here, just because it's so new to you, these topics, we're happy to meet you where you're at. And again, we're at 3305 Berquist Avenue in Spirit Lake, just off Highway 71. And again, a compassionate care team full of empathetic folks. We're always searching for the greatest things that are out there to help the body on that healing pathway, the new modality. But we have some big ones already that are ready and willing to supercharge you, get that oxygen elevated, and just excited to receive those conversations and start those journeys, Dave.
Very good. Dr. Meyer, always a pleasure. Thank you so much. Have a wonderful day, and we'll chat again soon.
Thanks, Dave. Be well, everyone.
Thank you. Dr. Bradley Meyer with us today, Okoboji Wellness Clinic. You can find out more at okobojiwellnessclinic.com.